What's up, everybody? Welcome to this week's episode of the Well Man's Podcast. My name is Brian Brosey. I'm joined by my friend and co-host Keoni. And today we are joined by a special guest friend of mine. Dr. Sarah Demars is the owner of Neuro PT, providing mobile in-home therapy. She graduated from University of Michigan's DPT program in 2010. She is a board-certified neurologic clinical specialist, Neuro IFRAH certified, in the treatment of hemiplegia from a stroke or brain injury, and has advanced training in vestibular therapy. She enjoys treating patients in their homes to truly see their functional abilities and to problem solve task-specific challenging activities, which is one of the many reasons I love mobile in-home therapy as well. Dr. Sarah Demars, Sarah, thank you so much for joining us on this episode of the Well Man's Podcast.
Well, thank you so much for having me. I'm really excited.
Thank you, Dr. Demars.
Thank you.
So
yeah, we are too.
Yeah, we want to talk about vestibular therapy, but before we get into all that, I did kind of want to break down a little bit more about your bio. So what is a neurologic clinical specialist, and what kind of additional training, education, and kind of what does that allow you to do?
Sure. That's actually a board certification through the American Physical Therapy Association. So it does demonstrate that I do specialize in the neurologic population. I did have to do advanced training, get a certain number of hours in the field, and then ultimately take a strenuous test.
Yeah. And it's a lot of training too, from what I hear, all the board certifications, of course.
Yeah, it took a few years to get it done. And then I have to regularly maintain my certification as well.
Okay. And then as far as IFRH, the Neuro IFRAH, I haven't heard of that. Can you break that down a little more?
We just pronounce it as Neuro IFRA. It is an acronym. It stands for Integrative Functional Rehabilitation and Habilitation. It's basically a treatment approach for people that have hemiplegia and how you rehab them. It was started by an occupational therapist out in California, and he does all the training. And that's also a pretty intensive 2 weeks to get certified. And then in addition, you do also have to maintain it. So I was able to go out to California and actually meet with him and get specialized training from their coaches there.
Okay, awesome. And then I was curious also, I know from my perspective going into PT school and many PTs, you're kind of gung-ho about like sports medicine going into school. How did you know you were going to get into Neuro PT, and then what kind of created Neuro PT, what you have now?
Well, very similar to what you said. I was an athlete in high school and college. So I thought, I'm going to go and treat all the athletes professional level. And so I went into physical therapy school like that, but I didn't know much about the other areas of physical therapy. So once I was out, my first clinical rotation, so we're out treating patients, but we're under the guidance of a licensed physical therapist. I was in a neurologic setting and I fell in love with it. And I was like, forget athletes, and this is what I want to do.
Yeah, the prima donna athlete is the the phrase we hear all the time. So as far as vestibular, like we mentioned, we want to talk really about vestibular therapy, and obviously you doing vestibular therapy in the home, but just break down kind of what is the vestibular system. I know people are maybe aware of canals and crystals. That's about it.
Well, the vestibular system is a really integral part of our body, and it helps us tell where our head is in space. So if my eyes were closed and I wasn't touching anything, if my feet were off the ground, I would still know where's up and where's down. So our vestibular system helps tell our brain that information. It also helps tell our brain about acceleration and how fast we're going. And then it plays a really, what I find really interesting is it keeps our gaze steady when our head is moving. So for example, when we're walking, we're actually going up and down. However, you don't see the world going up and down. Mm-hmm. So our vestibular system corrects for that. It is highly connected to our eyes, and there's a few different reflexes that keep that gaze steady.
So highly involved in obviously keeping our balance.
Yes. If your vestibular system has an issue, you're falling over.
Yeah, and it was interesting. I was watching like a NASA documentary one time, and they're talking about astronauts going into space and having some really weird vestibular input, obviously, because you're not getting that gravity, and your vestibular system is kind of floating in thin air. So how does the vestibular system kind of take in input? Is it just the movements of your head?
Well, it does use the movements of our head, but you did mention crystals, and that is correct. We do have crystals in our inner ear, and they're microscopic. You wouldn't be able to see them. They're behind your eardrums. You can't like look in your ear, have someone look in your ear and see them, but they sit on this like gelatinous membrane, and they kind of weight the membrane down. So through gravity, that if you turn your head, those crystals help move our hair cells in our inner ear. That triggers a neurologic impulse, and that's how our inner ear tells our brain when we move our head.
Mm-hmm.
I also heard that if you walk and you shut your eyes, that ultimately you can't walk in a straight line, right? You just walk around in a circle. You eventually make a circle at some point if you don't use your eyes, which gives you input too, right? Your eyesight.
Yes, their eyesight, so our visual system, our tactile system, our touch, and then our vestibular system. Those three systems work together to keep our balance. So if you take one away, like you're saying, take your vision away, the other two have to almost work harder to compensate for that.
Right.
And I know clinically, like the foam and dome test, Keoni, as physical therapists, will basically take one of those systems out at a piece to try and piece together what is the balance problem. I'm sure you're familiar with that as well.
And I guess you could take that one of those pieces out to enhance your balance too, right? To practice that or not?
That is one way that I train people on their balance is I'll take out their vision. So then they have to rely more on their vestibular system. Right. Or I put them on foam, what Brian is talking about. If you put them on foam, then they're not getting as clear of a sensation from their feet. So then it's also stressing their vestibular system.
So each component of that system can be trained to some extent, including vision, right?
Yes.
To help you with balance. That's great, because a lot of people don't think about that.
It's true.
So as far as what diagnosis go into this, first one that comes to mind is vertigo. Are there others? First and foremost, are there any others that go into kind of vestibular system and the pathology that may be going on there?
Well, vertigo is an all-encompassing term. It's not a diagnosis by itself, but it usually suggests that there is another problem going on. And the most common form of vertigo is from an inner ear disorder. Now, it can be very serious. There are other issues with the brain that could cause vertigo. But the most common is from an inner ear disorder, and specifically a disorder that it's also an acronym, Bppv. That would be the most common type.
And what's that stand for? That's like benign positional.
Yep, benign, which means, well, you guys know, it's not serious.
Yeah, right.
Paroxysmal, which means it comes and goes.
Right.
Positional in relation to our head position, and then the V is for vertigo.
I got to tell you, and you guys probably seen this too. I mean, benign makes it sound like it's nothing to worry about, but man, if you have it bad, you are in bad shape, right?
I'm so glad you brought that up. Yes, even though it's not serious to your health, it's not going to cause any catastrophic, condition. It drastically impairs someone's function. I mean, the commonly vertigo presents itself as the room spinning. So you're not able to drive, you're not able to go to work. There's lots of, it can be really debilitating.
And I guess the other thing is vertigo is just kind of, it's different than dizziness, right? I mean, how do you distinguish those two? Like you said, room spinning. So if you see the room spinning.
That's a telltale sign if someone says the room is spinning. But vertigo basically means the sensation of movement when your head is still.
Okay.
So either you feel the room is spinning. Some people feel like their body is moving. They feel like they're on a ship and they're rocking. I've had some good comments over the years. People feel like they're tumbling down a hill. They feel like they're free falling out of a plane. These are all things that patients have said to me.
Sounds absolutely horrible.
It does.
Tumbling down a hill.
Well, and it's also, so you don't know where you are, or your body doesn't know where you are in space. But also, like I had a number of patients, man, they come into my clinic and they're throwing up profusely. Like it's like, and they think they're dying, and sometimes, so it affects, when you get it bad, it affects everything, right? Not only your mental emotional state, because you're all stressed out, but your digestive system too.
Yes, there's a GI component for sure. Nausea, vomiting, all these
Yeah.
things can occur at the same time.
Sounds lovely. Yeah. And people who've had it, it's just absolutely miserable, right? But like you said, it's benign. So if you know what you're doing, if we know the cause, which sounds like is related to the crystals, right?
Mm-hmm. And Bppv, which is
Yeah.
the most common type, yes, it's related to the crystals. Now there's other inner ear disorders as well that can also cause vertigo. And some are treatable and some are more chronic, although there is medical management of them.
Okay. All right.
Typically, from your perspective, Sarah, our BPPV is the one you can address the easiest and the most readily?
I would say that is the quickest resolution of symptoms when someone has BPPV. So what I'm doing to treat that is the crystals that are in our ear, they're essentially in the wrong part of our inner ear. So they're stimulating our vestibular system when they're not supposed to. So commonly people will say, well, I laid down suddenly and I got vertigo, or I sat up suddenly and got vertigo. And so what I'm doing is I'm actually determining which canal in their inner ear is affected. So we have 6 total canals, 3 on each side, and any of them could be affected. And sometimes you have multiple canals that are affected at one time. And you determine which is the canal of concern, and then you do a repositioning maneuver. So essentially, if you think of holding a maze in your hand and there's a ball in the maze and you're tilting it and using gravity to put the ball back where it goes, that's basically what I'm doing with the crystals in their inner ear.
Yeah, it's really unique because it's one of those things you see a real quick resolution after you get that ball back in the proper position of that maze, like you were mentioning. It's one of the few things in physical therapy where it's like, boom, fixed.
Yeah, that's really nice when you can give that person the relief instantaneously. Yeah.
Absolutely. And so you kind of alluded to changes in position as possibly why this onsets. Are there any other things, or is it really just that change in position, or a quick change in
Or
position?
like why you're asking why it occurs in somebody?
Yeah.
Well, we don't fully know. There are risk factors. So generally, people in their middle age are more likely to have BPPV, especially women. So it is believed there's a hormonal component, that estrogen plays a role in keeping the crystals where they're supposed to be. And people who have osteoporosis are more likely to get BPPV as well.
Oh, wow. Okay. And it can happen suddenly, right? I mean, it can happen from like getting up out of bed or just lying down.
That's right. So it presents itself suddenly.
Okay.
People may have had the crystals out of place, but then they just do that particular maneuver and it shifted them to where it's stimulating our ear when it's not supposed to. So it's telling our brain one thing, but our vision is telling us something else. And that's why we have those symptoms, nausea, vertigo, not feeling well, feeling imbalanced.
Okay.
So it's curious to me, like if I get on a roller coaster, I might have some kind of dizziness or some vestibular feedback that's not necessarily correct, but I don't necessarily have the nausea, vomiting, BPPV. What is necessarily the difference between the two? Is it that the crystal is stuck in the incorrect position?
Well, we have fluid in our inner ear too. So if you spin on a merry-go-round or do anything really fast, that moves that fluid. And then that shifts the hair cells in our inner ear, which then sends an impulse to the brain. And that's why you would get dizziness, but it's temporary. It's for finite amount of time after you get off the roller coaster, then you're not going to experience it again until you get on your next roller coaster.
So with someone with BPPV, that crystal is getting stuck in an incorrect position, giving them that consistent roller coaster feedback, obviously a little bit more intense.
However, the crystal is still responding to gravity. So that's why they mostly feel the symptoms when they're in a certain position. And that's generally laying down. I hear that one a lot, but sometimes people, even when they're up and they're just turning their head. So let's say they're in a grocery store, and so they're looking for certain items. So they're swiveling their head a lot. If your lateral canal, because it sits like this, that's a sign of that canal being affected.
Okay. Which I think plays into my next question of just, you mentioned the maneuvers like the Hall Pike dicks and things like that you can do to reposition these crystals, but how do you, long-term try and work on this not coming back or being a consistent problem?
Mm-hmm. Well, I do a lot of education in that if someone seems to have the same canal affected, I can teach them a self-repositioning maneuver. So if we know what canal it is, then we can take out the diagnostic piece and they can just know, I can just teach them that particular maneuver. There's not a ton of research in this, but I believe that if we treat some of the other we call it ocular movement. So how our eye moves like side to side, up and down. I think if we train that system, that will help reduce the severity of the symptoms when you do have Bppv. So it's called our gaze stability. So when I was talking about when you're walking, you're going up and down, but the world isn't going up and down.
Mm-hmm.
So there's exercises that you can do to help train that system.
Okay. And then that should result in hopefully less occurrences of these Bppv symptoms.
Mm-hmm. Correct.
But once you have kind of that first round of Bppv or that serious vertigo, you're more inclined to have it occur again. Is that correct?
You are at greater risk of it happening again. If someone has it several times, I definitely recommend that they, get further evaluated by like an ENT. They could also have another vestibular system kind of going hand in hand. I mean, there's other things like Meniere's disease, vestibular migraine that need more of like a medical management.
And just for very general, the average person kind of, is it that symptom of, like you said, the world spinning around you, that is the general telltale sign that this is probably Bppv versus like Meniere's disease or any of those other things?
Not really, but it is interesting. Just having research does show this. If you just simply have a phone call with somebody and they describe their symptoms and the provider asks the right follow-up questions, they can pretty much determine what the cause is. Because Meniere's disease can cause vertigo too, but it's less positional and there's more hearing loss with that. So it's just all the little details that help direct determining what the cause is.
Yeah. So you got to have a practitioner that listens, and
yes,
more often than not.
It's very important actually in vestibular to listen to the subjective.
Absolutely. And then you mentioned, so you can teach these, if someone's experiencing this fairly regularly, you can teach them the maneuvers and they are generally able to carry that out even in like a fit of Bppv at the time.
Yes, they seem to, especially if they had the maneuver before and they know how that it made them feel so much better. They're very keen on learning it. Yeah. I do. Yeah.
I could imagine it'd be very anxiety producing not to have it again, right? Like you want to know what to do to get yourself out of it quickly, right?
Mm-hmm. And I'll typically provide a video, however somebody learns best. If they learn from a video or want me to handwrite the steps, whatever it takes to get them to be able to do it on their own.
Yeah. I've had a couple patients who I've sent to a doctor of PT to help them with it, because every time they do it, they'd get a little bit relief, but would not complete relief until they saw their PT.
Mm-hmm. And that can happen if it's, a more difficult case. You have to get the right, angles in the neck and the head to really, have the result. You want to clear all the crystals. Sometimes you can clear some of the crystals so you feel better, but it might reoccur.
Yeah. And when you say clear the crystals, they're going back to their home or they're being reabsorbed?
Yeah, they're going back to their home where they will be reabsorbed.
Okay.
Yes.
Huh. Interesting. So then the crystals are reabsorbed. Are we constantly, like as I sit here and chat with you right now, do I have crystals in my ears giving me that vestibular feedback, but they're just in their home?
Yes.
Okay.
Yep.
And then exactly. So what causes one to be reabsorbed?
Well, they generally recycle every month or so. So just for whatever reason, it didn't get reabsorbed correctly, and then they went into the wrong part. That's where more research needs to be done to determine, why do some people get it and other people don't get it.
Is it related to any of these other things? Like I've had a couple patients over the years who went on a boating, like an outing on a boat, and then they've come back, and from that point on, they feel like they've been on a boat for, like years after they did this cruise. They have this boaty feeling where they just feel like they're bobbing up and down. Is that related to it at all? It's the medical term, and my French is awful, but is mal d'embarque or something like that.
Yeah, that's right.
Right.
Well, I definitely would be interested in doing the diagnostic test for Bppv. I mean, I probably would just do a full workup, which for
and
me
just see.
includes the test, the Dix-Hallpike that you mentioned. There's other tests that the Dix-Hallpike primarily tests one of the canals, but there's two others on that side. So there's other diagnostic tests for that. Then I would definitely do a full ocular motor exam. So I'm looking at the ability of someone to track their eyes, to track an object, in space, jump from one object to another, their eyes jumping from one object to another, and then they're being able to converge, which means like come together. If you put your finger towards someone's nose, I would test all those things. Also, like there's things called the HIT test, which is the head impulse test. So you move someone's head quickly side to side, and then if their eyes are jumping around, that all gives me an idea of what's going on.
But as far as it's not necessarily related to like the crystals not being where they should be. They're not
as far as I know. I would suspect.
I haven't either. I don't think so, but I don't know.
I would suspect that they have some sort of vestibular dysfunction, and it just needs to be worked up a little bit more.
Okay.
I remember learning that head impulse test, and you grabbing the kid in class and making him all cheeky and shaking his head side to side.
Is that what you're doing with that test?
Too hard.
Is that actually what you're doing? You're grabbing the head and moving it back and forth. Is that what you're actually doing?
Yeah, so they're trying to keep their eyes on my nose, but I'm moving their head. And then I quickly, without them knowing, unsuspecting,
move their head.
And then quickly move their head. And if they can't maintain that, can't maintain their sight, then that's a positive test in that.
Okay.
So you can imagine a bunch of PT students in the back of class trying to do that to each other in the middle of lab.
Having a lot of fun with it too. Yeah.
I remember those days too.
Well, so my other question is, I see with this whole, with the pandemic that we're going through with COVID and stuff, right? And I've seen with post-viral illnesses, a lot of people after post-viral illnesses will get ataxia type of thing. And will again get this so-called boaty feeling. And I'm wondering if if that's related to any of this. I mean, it's definitely affecting those three systems that allow us to tell us that we're in proper space, right?
Yeah. Well, I've heard anecdotally of people who have had COVID and then 2 to 3 months later having Bppv.
Okay.
So, I mean, I think
there may be something to it, but
but yeah, why or what the physiologic reason is, it's not super clear.
I'm just wondering, I mean, it certainly can't hurt to do the assessment and take these people through these maneuvers and see if it helps, right? I mean, I don't know. Is there a downside to do it?
You would only take them through the maneuver if there's a positive test. And technically a positive test is if they demonstrate nystagmus, which was a oscillatory movement of the eye. The person doesn't perceive it. They're not aware that they're doing it, but that's a positive test. And that means I would do the repositioning.
If you did the repositioning without that, could you could you make their symptoms a whole lot worse? I mean, is that a possibility? Okay.
Possibly. I mean, you wouldn't just want to, if someone has vertigo, you wouldn't want to willy-nilly put them in a bunch of positions because they're going to feel worse.
Okay, great. Well, that's why I would refer to you guys instead of myself. But people do, like a lot of these people will go on YouTube and, will see a video and be like, oh, I'm going to put myself through this. And, maybe some get better, but I've actually experienced some people getting worse, I know. Or almost hurting themselves.
There's a lot on the internet out there, and I'm happy when someone can pick the right canal and do that right maneuver and they feel better. Like that's great, but unfortunately,
but essentially they're lucky,
right?
1
out of 6 chance of getting it right.
That's what I'm saying.
You roll the dice.
So you're rolling the dice. Okay.
Yes.
Okay. Yeah, that's why you see your doctor. Okay.
No,
the appropriate doctor, I should say.
Yeah. Now it obviously makes sense why this is beneficial. Someone probably can't drive to you while they're in the middle of having a BPPV episode. Typically, like in your exam, are they coming to you or reaching out to you, Sarah, while they're having these symptoms, or have the symptoms resolved? How long did these symptoms stick around if not treated, immediately with these maneuvers?
Well, I think like most people, they don't reach out until it gets really bad. So generally when someone reaches out to me, they're kind of in the throes of it and they want it taken care of right away. So it is a nice, I think a nice service that I provide going to them because they don't want to drive. We can take care of it in the comfort of their own home. I do generally like to do my full exam. If I suspect BPPV, do the repositioning maneuver, give them a way to do a partial maneuver on their own or do something on their own, and then follow up with them 3 to 5 days after to retest their canals. Because if I clear 90% of their crystals, but there's still 10% left, I don't want this to happen again. So I retest the canals, clear them again if I need to, or I might have cleared the worst canal if they have multiple canals that have the crystals in the wrong location. So I'm going to treat the worst canal, but there might be another canal that's giving them just a little bit of trouble, and then I would treat that one.
So typically, how often or how many times do they need to see you to see for a light case, not a very severe case, to get a resolution that they're looking for?
For a really light case, then it's just twice, okay? Because if I cleared it all the first time and then I retested them the next time and they're fine, then I don't need to reposition them again.
Okay.
However, most people that I find who have had BPPV for a while, meaning they've had it and then it kind of went away on its own, but then maybe a year later they had a flare up again. I find that I notice other things on their exam with their eye movements, and I do like to do a session of gaze stability training. So I teach them all the exercises so they can strengthen like that part of the vestibular system. I just feel that if that system's working well, then the symptoms aren't going to be so bad if it happens again.
Yeah, understandably. And as far as just like a general example of gaze stabilization exercise, can you give us a general exercise or example of one?
Yeah, so the most basic form would be fixing your gaze on an object about a foot in front of your face and moving, and while you're looking at that object, moving your head side to side and trying not to take your eyes off of it. Now, it might make you, for someone who is experiencing vertigo, that might make them feel dizzy, and that's okay. So we're actually almost trying to get to a point where it's a little uncomfortable. And if it's not uncomfortable, I have them go faster because we do want to make sure that we're actually adapting this reflex.
Yeah, it sounds like general balance training, where I always kind of say if you should be losing your balance about 25 to half of the attempts just to make sure it's a proper level of challenge.
Yeah, and I'm glad you brought up the balance, because also with people that have had vestibular issues for a while, they've been avoiding moving their head and sort of avoiding being active, avoiding getting in those challenging positions that you mentioned. So now their balance as a whole is affected. So this is especially true of like an older adult where, okay, we get the BPPV under control, the crystals are back where they go, but now we have to focus on their balance because just from, avoiding certain maneuvers, they need balance training.
Yeah, it seems like something, not that I'm aware of any research, but even like a performance aspect of it too. You think of a kind of wide receiver running down the field, tracking a ball the entire time, and having to maintain that awareness while stabilizing their gaze on the ball, which I guess the ball's moving, so it's not necessarily the same thing. But it definitely seems like you could, train that aspect of your balance system to have better balance.
Yeah, I think it's an overlooked area, honestly, because people do balance training with someone and they just think about putting them in these difficult positions or having them close their eyes, but you should do an ocular motor exam because it's really interesting what you'll find.
Yeah.
I think it's also by doing that, some it will relieve some anxiety. Like some people, when they get this, especially a first time of getting like severe vertigo, and then it gets treated and they get taken care of, they know that it can happen again. And one of my patients in particular is like very rigid now, keeps her head very still, doesn't want to move it fast or anything, which can, like you said, can lead to other problems, right? Because now you can, if your posture is different and your balance would be off. And not only that, you have the mental emotional stress.
Exactly. It's multi-component for sure.
Yeah.
There's so many things that go into it. And then the interesting thing about keeping your neck rigid is there's from our cervical area to our vestibular system, there's connections. So if you're not moving your head, you're also putting that at a disadvantage, or you're not using that reflex that actually helps us keep our balance.
Right.
So.
Yeah.
Is there anything? Go ahead, Keoni.
Go ahead. I was just, this one patient I'm thinking in particular, I mean, well, there's actually two. It's very, very anxiety producing for them. One of us like absolutely terrified it's going to happen again.
Yeah. And I think it's really important for multiple professionals, healthcare providers to come together, because there's so many different aspects, especially someone with like chronic vertigo.
Yeah.
There is the psychological component. There's, pathology. There's just a lot going into it.
Yeah. I've only seen it in clinic 3 or 4 times, and I agree with you, Keoni. I've always seen just that really intense fear of it happening, and then they become so rigid and fearful of moving and getting up out of bed or whatever the position may be.
Yeah, so it can be empowering to someone to know, well, A, what's causing it, and then B, how do I treat it? Especially if you can teach that particular person to do some maneuvers on their own. It can make them feel more empowered.
Yeah, absolutely.
Now, is there anything, Sarah, that we didn't ask or didn't mention that you feel like we definitely should?
Well, I think that there's other, disorders that physical therapists can treat other than Bppv regarding the inner ear. Like people have had concussions that can affect the vestibular system. So if one side of let's say you're hit in the head, so there's a, disruption at your vestibular system on one side. And so there's a mismatch now between your right and your left side that can also cause dizziness. So there's quite a few conditions that can be treated with vestibular therapy.
And piecing those together would take, like you mentioned, that oculomotor exam, all these different pieces, and
correct.
Obviously a history.
Yep, that's right.
Anything else, Keoni?
No, I find it's interesting. Your last comment is, if you have any type of head injury, that it probably would be good to get that assessed, especially, and that's happening in athletes who really, really more so than the average person depend on that whole system, right?
Yep. Very big in concussions. And then think of an elderly person that falls and hits their head. And, it's not just, is there a bleed on the brain, but also we need to look at more concussion type symptoms.
Right. Yeah, it's all about it's all about preventing a fall, right? Especially in the elderly. So whatever you can do to help prevent that.
Yep.
So I guess that's where a lot of the training would come into, and training each of those components of what I'd call your balance system.
Yeah, and that's the fun of it. I kind of get to be a detective and determine, well, what is leading to their falls, what internally, and then what in their environment can we modify as well to prevent falls.
Right.
Which is one of the great benefits of being in home, obviously.
Yeah, that's why I like it.
Yeah, same here. Anything else, Keoni?
No, that was fascinating. Thank you so much, Dr. Demars. That was fascinating.
You're welcome. Thank you for having me. It was great to talk to you both.
I guess my last question would probably be this. I mean, if I have a person with this condition, like, who would be the primary person? Would it be a doctor or PT that I refer to help this right away? I mean, I've seen people come into my clinic, and I'm not trained. I haven't been trained in it. I mean, my training is essentially, well, let me see what I can find out, basically. And, I'm looking for somebody, but any doctor or PT, I would think, can diagnose and treat, or do you have to go to somebody like you who's a specialist? So, and if that's the case, how would we find someone like you?
Yeah, I think that not everyone feels comfortable with it. And just they may not have the practice doing it. So you would want to find somebody that specializes in it or, advertises that they do treat,
it. Okay.
inner ear disorders.
Yeah.
Just like I wouldn't want to treat somebody with a pulled hamstring. It's just because I haven't done it in a while. So
Right. And you want to refer to the person who has the experience, right? That knows and can actually differentially diagnose if needed too,
correct. Yep.
So
Is there a database or a group where people can find local practitioners for this specifically?
The APTA, which is the American Physical Therapy Association, if you do go on if someone from the public does go on their website, they do have a database for vestibular providers. So you could start there. You could also just Google search vestibular physical therapy, in your particular area.
And that's really what it is. It's a doctor of PT, right? Where it's probably going to be the expert of choice, at least for this condition, which can then, if it's not that, knows how to refer you out if you need to.
Yeah.
Right. I mean, it's certainly not somebody. Yeah. It's certainly not going to be somebody like me who's just trained as a general practitioner, and had very little training in that,
Yeah, but you're going to see these people and
absolutely.
being able to educate them on what you suspect that they have and then refer
Yep.
to the right person is so crucial.
No, absolutely. Right. It is. So thank you so much. That's great.
Yeah, absolutely. We will have all of the links and information to get in contact with Dr. Sara in the show notes. Other than that, it is Neuro PT is your company, and you do in-home physical therapy specifically for neurologic conditions, just like the vestibular system that we discussed here.
That's right. Yep. In Jacksonville, Florida.
Awesome. Well, thanks for joining us, Sara.
Thank you.
Thank you.